The NHS is part of a total context of society, and there are three essentials. One is that people realise if the NHS continues to be free at the point of need, that they have to treat it with respect. Let me give you one obvious, rather pedestrian example, which is that now, for the first time, quite a lot of appointments aren't kept. And that's because people don't feel a sense of gratitude to the NHS, a sense of obligation towards it. They treat it like another commodity. Second example is that people may resent very much paying taxes for the NHS, not recognising that actually almost any other system is going to be more expensive. That fact hasn't really come home adequately, I don't think. And thirdly, the sense that you have to take a large part of the responsibility for your own health also hasn't come through adequately. And the reason we have massive increases in diabetes is because people don't take exercise. They know they should, but they don't. And they don't fail to buy inappropriate foods, although they know they should. So you do have to bring a cooperative group into this. And in a way, because we're very much a consumer society, we don't expect to have to make decisions which reflect our own responsibility for ourselves.
In the end, I remain confident that the NHS will survive, indeed that it will prosper based on its founding principles of free at the point of use, universally available. But I think it's going to be a very difficult time. But the reason in the end I have confidence is because I think that values and ideas are the most important thing of all, and it is still the case that the values and ideas of the NHS inspire and move people. And so although difficult times are ahead, I think that one way or another we will solve the problems that the NHS faces. But we do need to learn from what has happened over the last few years and is happening now, and try to make sure that future change is evolutionary rather than involving massive, expensive and demoralising reorganisation.
Well, I'm confident that the range of services that are currently free within the NHS will continue to be free. Yes, I am confident of that. But we need to understand, don't we, that we can't use the rhetoric of joined up services, breaking down the barriers between the different parts of the health and care system, without recognising that if it's to be a joined up service that delivers care for elderly people living at home, for which we charge now, I don't believe there's anybody in the political spectrum that believes we can be extending the scope of free services to cover the whole of the health and care system. So yes, the heart of the NHS will continue to be free, but the health and care system seen as a whole has never been free.
I very much hope that the NHS is going to be free at the point of use for future generations, but I'm really afraid that I'm not confident about it, because it is the subject of an ideological attack at the moment by politicians. And we've really seen it brought to its knees from a successful service, which it was at the end of the last government, to a service in chaos at the moment, and with a Secretary of State who's now no longer responsible for providing a service, but for promoting it, and who now seems to think that his job is to criticise the staff and undermine the service and denigrate it and alarm patients. It is a really beloved institution, and I think once people understand what they are going to lose if it does fragment and go out to the private sector, they will start to fight. And so I think we're really in the hands of the public over this. If they understand they have to go out onto the streets, say they want the NHS, as we have had it for 65 years, publicly funded, publicly provided and publicly accountable, all of which we stand to lose, then the public will fight that fight, and we will keep it. But if they wake up too late, I'm afraid it is going to be broken up, sold off, and it'll be too late to get it back again.
Look, the NHS people think of it as an institution, and it sort of is, or an organisation, and it sort of is. But actually what it really is a set of values that reflect the values of the country. And the values of the country are all about fairness and decency. And a critical thing for us is that we have a system of care which we can be so proud of in this country, which treats people according to their need and not their ability to pay. It's the scale of your need, not the size of your wallet, that dictates the care that you get. That's a good principle. Okay? So the principles of the National Health Service seem to me to be sound, and we should be confident about them. However, to maintain those principles, we've got to change some practices. And we've got to stop thinking that the only way of improving the quality of care is by continually increasing the share of the national budget that the National Health Service takes. That is not a sustainable proposition. You know, we're in a new world right now, an age of austerity that is probably going to become semi-permanent. And in that world, what counts is value, getting better outcomes, not for high cost, but for low cost. And everybody, everywhere, leader or non-leader in the NHS, has got to start thinking in those terms.
I'm confident the NHS will be available if, and only if, the public want it. It won't be available for future generations just because of political whim or reorganisation. It will only be available if it gets a lot more patient focused, if it understands the core focus, because we're seeing a consumerisation of healthcare. We're seeing people looking much more for choice, to be more demanding about what they get, more responsive, more open, more transparent services across all sectors of society. If healthcare doesn't respond to that, and in particular if the NHS doesn't respond, it will be left lagging a long way behind, and the NHS will just be left by the public.
I'm not at all confident. For 30 years, Conservatives have been circling around the NHS. Let's remember, in 1983, Geoffrey Howe published a paper which he presented to the Cabinet advocating dismantling the welfare state and actually abolishing the NHS. That paper didn't get very far. It caused a riot in Cabinet because it was seen as politically too toxic. I think actually it was wicked, never mind politically toxic. But as time has gone on over the last 30 years, that vision, or that negative vision, has become less and less toxic. So I'm actually quite worried that there will be an agreement within the political class, quite separate from any electoral mandate, that the NHS is an idea that basically has passed its sell-by date, and we could end up with something much, much worse.
So yes, I am confident. The NHS is something that's felt deeply within the heart of the British population, and I don't see any politician giving up on that. However, I do think people are going to make bold and decisive decisions in the next few years, some of which will be very challenging. We absolutely need to give more responsibility to patients and to the public, and we also need to create a much more adaptable and flexible provider side. Whether that means private or NHS, I'm more agnostic, but we certainly need to change things very radically.
I'm not confident the NHS will be available as a free at the point of use service. It depends very much who wins the election. I think if the Conservatives win next time, given how far they've gone, at the last election they promised there'd be no reorganisation. David Cameron's main campaign at the election, big posters, was, you know, I will save the NHS, I will cut the deficit and not the NHS. He has ended up cutting the NHS because a zero increase is the same as a cut. And he has ended with an enormous reorganisation whose whole point is competition and bringing in the private sector to tender and take bits out. If they were to win another election, they would be absolutely triumphant. There'd be nothing to stop them disintegrating it altogether. There are large parts of the Conservative Party, particularly the younger MPs, very radical, certainly not remembering the old days when the NHS was formed, who really think the NHS's existence is a challenge to their political ideology. NHS, BBC, great big state-run monoliths, they want to destroy them. And they would if they won next time.
I think the thing for me, the real challenge is around patient empowerment and what we actually mean by that. And I think one of the realistic things we need to look at is how far away are we from that at the moment. And sometimes it's a phrase that is bandied around by politicians and others, and actually we need to try and understand, what does it mean? What does it mean to very different people at different stages of disease? And how do we move people towards becoming more empowered? And there's also something around this debate that we've heard tonight. It's fine to hear here, but actually we really need to hear it in public to really understand where we are.